Key 2, counting on Medicare or Medicaid is not a plan most people want to rely on for long-term care, and many people aren't even eligible anyway. It is worth noting that some states are currently studying how to reform their long-term care programs. One state, Washington, has launched a state-run long-term care insurance program, but it's still in its very early stages. Many people incorrectly believe that Medicare will cover their long-term care costs. As good as Medicare is, long-term care is not covered by Medicare, which only covers short-term rehabilitative care that is less than 90 days. The critical word here, rehabilitative, for Medicare to pay for any services, the medical opinion has to be that the patient will recover and live a fully independent life again. Additionally, Medicare covers you for rehabilitative services. It's essential to understand that Medicare only pays for certain short-term services like skilled nursing and therapy, such as speech therapy or physical therapy. But it does not pay for custodial care, the kinds of help with daily living activities long-term care assists with. It also pays nothing for senior independent living or assisted living costs. Now, Medicaid is not Medicare. It is a state and federally funded means-tested poverty assistance program that may cover eligible individuals' long-term care needs. Many low-income Americans use Medicaid to pay for long-term care. Medicaid pays for long-term care services that Medicare does not. A key surprise is that you must use almost all of your assets to pay for your care before qualifying for Medicaid benefits. The Medicaid applicant can only have $2 in assets. Your non-Medicaid spouse may keep some limited assets, but amounts vary from state to state. Income is also severely limited for a Medicaid recipient, with most states capping income around 100 to 200% of the federal poverty level. To give you an idea of what this looks like, a single person can make no more than $16,300 per year or $1,300 a month in California. While some income and asset protections exist for the healthy spouse of a Medicaid-qualified long-term care recipient, these protections are not unlimited. Even if you have exhausted many of your assets as you approach the need for long-term care and your income is low, the look-back period may disqualify you from enrolling in Medicaid. Usually covering the 5 years before your Medicaid application, the look-back period seeks to establish if you have transferred any assets to others. If assets are transferred during the look-back period, you will be disqualified from Medicaid even though you no longer have the assets at the time of application. Even if you qualify for Medicaid, you may still be in for a rude awakening. There is a significant shortage of Medicaid beds within all long-term care living facilities. Not every room or bed in a facility will qualify for Medicaid payments. Long wait lists for Medicaid beds can exist even with lower occupancy rates. Sometimes people do not initially qualify for Medicaid when they first enter long-term care. As they spend their assets to pay for their housing and care, they become qualified. While this may sound like an okay option, there's yet one more big surprise. The room you have been living in may not be one designated as Medicaid. You can be forced to move from the room you've been occupying to a less desirable Medicaid room when Medicaid starts paying for your care. The issue of being forced to move to a different room will become even more significant as baby boomers age. By 2030, all boomers will be 60 or older, making 1 out of every 5 U.S. residents of retirement age. Since Medicare doesn't pay and Medicaid requires you to use up your assets, these high costs must come out of your pocket, even if your retirement planning considers future non-long-term care medical expenses, which can be significant. You can see how long-term care expenses can significantly affect your planned annual income numbers. Not planning for long-term care is costly and risky.